Okay, thank you everyone for joining us again after our hiatus in the webinar series. I'm really happy to see so many of you coming back, and any of you who are here for the first time. Oh, we've got a lot of people coming in still. Please do go ahead and mute yourselves. Okay, I think we've got everybody muted. As you're coming in, my name is Michelle Scartharian. I am the Executive Director of the International Childbirth Initiative. This is our sixth in our 2024 webinar series. Today's subject is evaluating experiences within a humanized, respectful childbirth model. That is going to be presented by our fellow, Ynez Kerley, who has been working with us for about a year now in Santiago, Chile, along with Ronny Valenzuela. So I'm going to go ahead and hand this over to Ynez to tell you about her work. So she's going to give her presentation, and then we will have time afterwards for Q&A. So as she's going through, please keep any comments and questions you have, put them in the chat. So we've got that going, and we'll have some time for discussion at the end. Ynez, I'm going to go ahead and hand this over to you.
Thank you so much, Michelle. It's lovely to be here talking to you all, and it's always really amazing to see all the different places that people are coming from and all the things that people do who come to these webinars. As Michelle said, my project is about evaluating experiences within a humanized, respectful childbirth model, specifically in Hospital La Florida in Santiago, Chile. And I've been working with Ronny Valenzuela, who is here as well, as my co-investigator. So yeah, here's me and Ronny. I graduated from Rice University last year, studying sociology and medical humanities, and made my way here to Chile through the Wagner Fellowship, which was awarded to me by my university to study in a foreign country. And I am an incoming medical student at UCSF this fall. And my co-investigator, Ronny, is the supervising midwife of the women's ER at Hospital La Florida, and is also the hospital's team leader for the ICI committee. In this presentation, I'm going to give an introduction to La Florida and ICI and talk about my research project, including the basic methods and goals. I'm going to go over some emerging themes because we're still kind of in the preliminary phase of analyzing the data, and also highlight some specific patient experiences from the interviews I did. So to begin with, Hospital La Florida, Doctora Eloisa Diaz, which is the full name, but I think I mostly use the abbreviation HLF in this presentation. This is a public hospital that was founded in 2014, with the maternity ward being established soon after. It's in Santiago, Chile, and serves the municipality of La Florida. So this hospital primarily serves residents of that area of the city, but it is open to all free of charge as it is a public hospital. La Florida has an accreditation as a friendly hospital, which means that it has high standards of patient satisfaction, of which the maternity ward is a part. And this maternity ward is unique compared to others in public hospitals in Chile because it was founded with the model of respectful humanistic care in mind. And this includes one-to-one attention with one patient to one midwife attention on the maternity ward. To give a little bit more context about the hospital, it had about 2,300 deliveries this previous year, which is slightly down from 2022, but that is a trend across Chile in general. The C-section rate is close to 40% and has gone up just slightly in the past year. And there's also an emphasis on skin-to-skin contact immediately following birth, ideally over 60 minutes, but also typically over 30 minutes, and early breastfeeding. And in context of Chile as a whole, it has well, these are statistics from the average of public hospitals in Chile, and unfortunately, there's only data up to 2020, which was also obviously kind of an odd year. So it's not exactly clear how the total number of deliveries in public hospitals have changed, but the cesarean rate as a whole was 43.1% for both years. And I think it's also important to note here that in private hospitals, the cesarean rate is much higher, over 50%. So Hospital La Florida was certified by the International Childbirth Initiative 3 years ago. And since they have assembled their committee, which includes doctors, midwives, social workers, among other types of professionals, they've done several rounds of ICI questionnaires with postpartum women. And one of their primary goals has been to expand the use of birth plans so that patients can make better informed decisions once they're actually in labor by having the information and their preferences written out beforehand. And I included a picture of the birth plan so that you can see basically what it looks like. It is distributed to patients through the clinics that serve the hospital in the surrounding area, where they would go for
Alex
their
told me you picking him up this afternoon after he's finishing playing match. Thank you, bye.
Yes, so the birth plans are distributed to patients in the clinics surrounding the hospital where women go for their prenatal care, but they're also available and accessible easily online to anyone who might be interested in going to La Florida for their birth. This is what the maternity ward at La Florida looks like. There's two main areas. So first, there's a traditional maternity ward, which is shown on the left. And on the right is the comprehensive birth room, or SIPE, which stands for Sala de Atención Integral de Parto. And both offer very similar options to patients. But the difference being that the SIPE is definitely more private, as it's an individual room, whereas the traditional maternity ward has 8 beds that are separated by curtains. So there's a little bit less space and privacy, and slightly fewer options in terms of, for example, movement and position. As in SIPE, you have your own space to move around and choose whatever position you'd like to give birth in. There's also a jacuzzi in the SIPE rooms that patients can use. But patients in the traditional maternity ward also have access to things like the yoga balls and the peanuts, and ability to move around the hallway and the space around as they want to. The patients who are usually able to use the SIPE rooms are considered lower risk. And so patients with other conditions will normally automatically go to the traditional maternity ward shown on the left. And this is what the SIPE rooms might look like when they're in use. So there's the ability to dim the lights as much or little as the patient prefers. And there's other implements so that they can create a more personalized environment. But all patients have access to things that I mentioned before, to do exercises or manage pain throughout their birth. Moving on to the outline of the study, this will kind of go over what the original project proposal was in a basic outline. The official title of the study is Valoración de Experiencias de Parto del Modelo Humanizado Respetado en Hospital La Florida, which is the same as the title of the presentation, Evaluating Experiences in a Humanized Model. And this project has the broad goal of evaluating patient experiences at HLF, especially their interactions with staff, in addition to their expectations and values surrounding birth. We wanted to learn about provider experiences as well and how they work within the model of humanized birth, especially any challenges that they face in implementing it to the fullest extent. In order to find out about this, we interviewed approximately 150 postpartum patients during their hospital stay after their birth. And this was basically a random selection of patients. So it included a variety of patient history in both cesarean and vaginal births represented. There really were no exclusion criteria for the patients that we interviewed. There was additionally 40 staff interviews, which included doctors and midwives and technicians who had to be full-time employees. So we didn't talk to part-time workers. But the 40 staff interviews that we did represented about 20% of the full-time staff who work with patients on the maternity ward. And the interviews themselves were semi-structured. So I had an interview guide with specific questions, but the interviews flowed pretty freely in that I was able to ask follow-up questions and allow the patients to talk about what topics seemed most salient to them. The interviews are all about 30 minutes long, depending on how much or how little my interviewee wanted to talk. And I completed them in about a 4-month period. As you can tell from the goal, this was a very exploratory project. We didn't have a specific hypothesis in mind or a very narrow frame or particular aspect of the experience that we were looking at. But because this model has been at the hospital for about 10 years now, without being studied in a systematic way, the exploratory approach was to just get a sense of how patients are feeling about the model and interacting with it. As I said, the interview guide was very broad, but there was 4 main sections. So first, I gathered demographic information and history from the patients, including their age, their country of origin, and language. I asked them about their medical history, obviously focusing on their pregnancy. So if they had any complications in this pregnancy or previous ones, and whether either were considered high risk. And I also asked about whether they had completed a birth plan or had received any other information or education before their birth. Then we talked about their expectations for their birth before they arrived at the hospital, including what kind of room or environment, any medical procedures they expected or preferred, how they expected to be treated by staff, and any fears or worries. The next section went into further detail about treatment from the staff at the hospital. So whether they felt respected and supported, whether communication was clear, and whether there were any instances of discomfort or mistreatment. And finally, I went through a pretty extensive list of things that may have been offered to patients throughout their experience, including pain management, medications, their position during their birth, whether they were able to have accompaniment throughout their birth, and a lot of other things, including how those decisions were made. So if there was a discussion, and a verbal decision or a written consent form, for example. So to explain what I was actually doing in the hospital, I basically was in the postpartum floor of the hospital, approaching patients and introducing myself and introducing the study. So I really was roaming the halls with my notebook, seeing who was willing to talk about their experience. And as I said, I selected patients at random and would explain and walk them through a consent form. And the interviews were typically recorded unless the patient requested that I write notes instead, which I think about 20 of the patients that I talked to did, but I always offered the option for it to be written instead of recorded. And I usually had about 3 interviews with about 1 or 2 other patients declining to participate for a variety of reasons. This is a summary of the sample of patients that I talked to. So overall, there was 153 complete interviews, with 5 being incomplete due to bad audio quality or the interview being interrupted for a variety of reasons. And out of those 153, 112 were from Chile originally, but 41 were immigrants or foreigners, which encompassed a lot of different nationalities. I think the most prevalent was Venezuela, but I also talked to patients from Ecuador, Colombia, Peru, Haiti, and Brazil. Only 4 were not native Spanish speakers, but all of them chose to interview in Spanish. All of them spoke Spanish well enough for me to speak to them easily, and although there was a translator available for Creole-speaking patients, they declined to use a translator for the interview. There was a really wide age range from 18 to 43, with the median being about 28, and approximately 3/4 of the patients were from La Florida, and the others were from other municipalities, or we didn't get a response about where they were from. Of all of my interviews, we are in the middle of transcribing and coding. So I have about 30 fully transcribed interviews with 21 preliminarily coded. And of those 21, which are what I'm going to be talking about for the rest of the presentation in the results section, they were about half cesarean and half vaginal births. About 10 out of 12 were considered high risk. 8 had a birth plan before they came to the hospital, and 10 were first-time mothers, with the other 11 having had a previous birth. So hopefully that helps to contextualize the sample that I was talking to and some of the data that you'll see with the quotes and results I'm about to show. Oh, but first, just to talk a little bit about the analysis process, there are 4 main steps to how I'm going through the data that I've collected, starting with throughout the interview process itself. I recorded basic information about each interview, including the patient's date of birth, country of origin, and current municipality in a spreadsheet. I then transcribed using a software called Transana, which allows for, well, it makes automated transcripts, which you then can correct and format. And Sarah Hinton has been helping me a lot with this, so I really appreciate that, because transcribing is definitely the biggest hurdle to making the data accessible. And during transcription, I began to create what are called collections in the software, which are basically just categories to put interesting or salient quotations. So this was really just to kind of gather my thoughts and start thinking about and recording the ideas that were coming through very often in the interviews. And I've put a screenshot of some of the collections that I've had, which encompassed categories like good treatment and pain management, how information was shared to patients, and what the decision-making process might have looked like. So they're just to start gathering ideas, really. And then the final step for now has been a more systematic approach to the interviews, where I have been tagging them with this software called Tagit, so that I can separate the data from each individual question. So that is what I've done with the 21 interviews that we have finished analyzing so far. And in the preliminary phase, we chose a set of topics just to focus on for now, because the interviews do encompass a lot. And so in order to get some results, we chose these topics, which include general background information, like any complications they might have had, and the care that they received during their pregnancy, like how many visits they had and what provider they visited with. Then some information about their expectations, like any anxieties that they might have had before giving birth. Then general positive and negative aspects, like what went right and what went wrong in their mind, as well as anything that surprised them and that they weren't expecting. And then also some questions about treatment, and what were signs of respect, and specific things that might have helped them with pain or to help them relax during birth, and what options they were offered for C-section and for pain management. The topics that I chose to talk about and analyze in greater detail for this presentation are, first, the importance of encouragement and accompaniment from midwives. And I chose this because I think without a doubt it's the most salient, prevalent topic throughout all of the interviews I've read. I think basically every patient mentions that they felt really secure and supported by the midwives in the maternity ward. And a lot of them express a lot of gratitude for the midwives. So it's clear that this is one of the most important things that La Florida is offering to patients. And then the other topic is about knowledge and respect. So I wanted to know how respect was defined by patients in this context. And I found, interestingly, that something important for a lot of patients was being provided with information. Of course, being included in decision-making is a big part of respectful care. But specifically, so many patients mentioned how just being continually informed of what was happening was really important for them. Contrary to this, some of the instances I found where patients felt disrespected occurred when staff perceived them to be lacking in information. So I will show some examples that kind of show what that means. One of the questions I asked was, on a scale from 1 to 5, where 1 is very disrespectful and 5 is very respectful, how was the treatment from the hospital staff? And of the 21 interviews that we have currently coded, all 21 responses are 5, very respectful. And so the follow-up question to this, what specifically demonstrated this level of respect, had a few different main kind of answers, which I divided here. So attentiveness was one of the most common, with people mentioning words like attentiveness itself, or that care was fast, or that staff was concerned for their well-being. Then knowledge, which is the one I'll go into more detail about, with patients mentioning that they were informed, that things were clarified, that things were explained to them. A lot of patients also mentioned that staff asked them a lot of questions about how they were doing. And that's similar to attentiveness, but so many said specifically that they were asked that I made it its own category. And then consent was also obviously important. So patients mentioning that they were asked permission for things, for procedures, given options, or asked if they were in agreement. And the last two are calming or encouragement, and empathy. So describing that staff listened to them, cared for them, or were kind to them. And I was, I guess, in my mind, when I thought about respect, I really expected it to be focused much more on consent and empathy. So to see that patients being simply informed, which is such a baseline thing, I think, in a medical setting, to be told what's happening as one of their top most important things to feeling respected, was surprising to me, and why I wanted to highlight it. So, for example, this patient, after being asked the question, what specifically demonstrated this respect, the first thing they said was that they explained what they were going to do and why they were doing it at every point. She also said that they were very kind and that they understood her pain. Similarly, this patient responded that they always asked how I was feeling and what I needed. They gave me options. They don't make the decision alone in a lot of things. And they always asked me or discussed with me how everything would go to be sure that I agreed. And then finally, this patient said that they felt respected by the constant questions, such as, do you need something? Do you need this? And including informing her of things that seem smaller, like when the midwife is going to take a break. She said that's something they don't normally do. Specifically, like, I'm going to eat, but this person will stay, and so will a doctor. So she felt like informed even about the small things that were going on. And I think that also emphasizes the accompaniment that the midwives are trying to promote, the feeling that the patients won't ever be left alone. So moving on to instances of disrespect or discomfort, only 4 out of the 21 interviews reported an instance that was uncomfortable or felt disrespectful. And several of these occurred when staff perceived patients as lacking knowledge. So the first one that caught my attention was a patient who forgot something that she was supposed to bring for her baby. She didn't know she was supposed to bring it. So she asked for something. She told the nurse she didn't have it. Can I borrow it? And they were annoyed by her. And I think she says that 2 different nurses seemed to be annoyed by her not having this, or not knowing that she needed it. Similarly, this patient describes how her baby didn't want to feed. She was sleeping peacefully. So I asked a woman who came in to take her blood pressure. And instead of giving her some advice and explaining, which is what she was hoping for, she became annoyed. Like, haven't they told you this isn't your first baby? Things like that. And I said, no, because this is my first baby. She says, of course, everything that this nurse said was right. So I guess this patient thought maybe she should have known. But unfortunately, her perceived lack of knowledge led to an instance where she felt disrespected. I think it's important to point out that despite these negative experiences, these patients still rated their experience overall very highly. And they're really clear in saying that this one experience doesn't reflect on the staff as a whole. For example, the patient who had that experience with the nurse just previously when she was trying to get help feeding her baby said, not everyone is the same. Perhaps she was having a bad day or something. And another woman said, even though my experience was bad, it was a one-off, so I can't pigeonhole the rest of the staff for a bad incident with that woman. So even though they have experienced a negative interaction, it's clear that their experience before and after that were show them that the staff really did have, the hospital as a whole was not at fault. They felt supported before and after during their birth and later, so that they didn't want to blame the rest of the staff. And I think that has a lot to do with the care of the midwives and the support that they provide patients. So to give you some more examples of that, patients are really impressed by the level of attentive care in the maternity ward. Sorry, I put the Spanish word here, but the maternity ward is the pabellon. And they often say that the treatment exceeds their expectations. So this patient had a really lovely quote saying that the midwives created this whole environment of protection towards me, which made me feel super welcomed. And as a loved one, even though she didn't know me or anything, I felt super loved by the anesthesiologist, the midwife. In fact, the midwife took photos of me. I mean, she created a really nice environment, so I'm super grateful to them. And this is one of the same patients who had a negative experience before. So despite that, she felt very respected and even loved by the providers who were taking care of her. This patient also said that the midwives were really encouraging. She said at one point during birth in the ward, all of them were like cheering for her, basically. They were saying, ready, let's go. They were encouraging her. And she says, I think that if I hadn't had that, if I hadn't have heard the nurses and everyone who was there, I think it would have been much more difficult, but she felt really good in her experience because of the encouragement that she received. For the last part of my presentation, I wanted to go through a specific interview where a patient mentioned a lot of details about her experience. This patient mentioned that she was a healthcare worker, so I think that's why she was paying extra close attention or remembered a lot of details in specific. But it really helped to get a sense of what the experience is like for patients. She said that her previous experiences and her 2 previous births were traumatic due to the treatment from staff. So she came to the hospital with a lot of nerves and feeling kind of scared. She said, my 2 previous births were horrible because the people don't treat you well when you go to give birth. So the patient came in for an induction and she also expressed worry about this, that the process might be longer or more painful, but in the end, the care really surpassed her expectations. She pointed out a lot of specific aspects of her experience that really surprised her, such as her family being able to be involved in the care. She said there's family involved, the father is excited, and he also deserves to have attachment or skin-to-skin time. And they were able to have 150 minutes of skin-to-skin after the birth, which is quite a bit of time. This patient did have a negative experience with one doctor, but similarly, she explains it as a one-off interaction and says that she's still really satisfied with the care. she said, I didn't like the doctor. I don't know his name. He didn't introduce himself. He came, he looked at my chart, and he left. He didn't even say hello. But she does say, I think it's because he's older. So maybe some healthcare providers who are older don't have the same good model of care. And finally, when asked what was the most important thing that helped her to feel relaxed throughout her birth, she also brings up the attentive and personalized care that the midwives gave her. She said, to understand that my pain is not the same as the pain of a person next door, not even the pain that they felt at some point, as bad as they were. Everywhere they are different. So from the beginning, they already respect and value it. It feels very comfortable. Even though the midwife was normal, she doesn't feel the same pain as me either. So the midwife was able to treat her as an individual, I think is the most important thing that she pointed out, and respect that when she said that she was in pain, respect her individualized experience with pain and provide her what she needed, without equating her experience to anyone else's. Yeah, that's the last bit of my research results. So in my conclusion, I wanted to say that on a more personal note, doing this research project has been, I'm just feel very grateful and lucky to have been able to spend the past almost a year pursuing something I'm really fascinated by, and pursuing it in an independent project where I got to just kind of follow what interested me. And obviously I had the support of Ronny and Michelle, so they really helped bring this project together. And I learned a ton. Like, it's hard to condense an experience that has been my entire life for the past year. Because being in another country is its own whole thing that I learned so much from. But the research itself has also helped me understand so many perspectives just from doing the interviews and sitting down with 150 different women who each had their own individual birth experience. It was very intimidating to enter the hospital as a foreigner, and I definitely had my share of awkward or confusing moments, but the conversations I had were so invaluable, and feel very grateful to the staff of La Florida that they allowed me to come in and take up space where they're so busy, and also so many of them got involved in the research, which was really amazing. So yeah, thank you for everyone who helped with this project. And I think now I can open it up for questions.
Ynez, thank you so much. That was wonderful. There's a couple of questions in the chat. Definitely others, please go ahead and put some questions in there if you have them. But I wanted to see if Ronny, if you wanted to say anything before we move on to the general questions.
Thank you, Michelle. Well, I just want to congratulate Ynez. I've told her in person, but it's always really important to do it in public. She has done an amazing work. For myself and the whole team are really, really happy to have her. She was someone that brought this idea of looking into ourselves, and that's always hard, right? But it's fulfilling at the end, and we are really happy to know more about what we're doing and what we can do better. So once again, Ynez, thank you. It's been great, and I'm sure that we will see each other somewhere else in the world working together again. So just that. And also thank you to everyone that is connected to this meeting, because it's really important to show to the world what La Florida Hospital is doing. So thank you all for being here today.
Thank you, Ronnie. So I wanted to so Julia asked a question in the chat that, Ronnie, I know you gave a bit of an answer to the distinction between who is in the different types of delivery rooms, or the differences between the delivery rooms, the private versus the ones that are separated by curtain. But I think there is some difference as far as eligibility, right, for the private room.
Yeah, but
For-
just a few. There are some diagnoses that when we need to have a better monitorization of the patient, you know, to have a bit more of control. In those cases, we leave the patient at the normal labor room, but we try to encourage the use of the SIPE room at the most. So we are also talking now about how to be more flexible about this criteria. But about the staff and the rest of the care and the model is the same. We try to do the same despite where the woman is in labor, right? We do aromatherapy, we use the balls and the other implements. She can move around, of course, and Ynez said it in the presentation, it's not the same space, but the freedom of movement is it's the same for everyone. So yeah, we try to do the same in both places, but it's just a little bit different.
And I saw that it also came through a bit in the interviews. There were some women who had come specifically because they knew there was the private room, but they also understood that if, you know, when they had complications, they might not be eligible or they had to be moved to other areas. And they all seemed to sort of respond that the care was so good that it didn't necessarily impact them. But I think there were one or two women that said that they wanted the private room and they were able to get it and they were really happy about it. Sarah, you've got your hand up.
Yeah, I would love to just make a couple quick comments. As I've been processing these interviews with Ynez and Michelle, I wanted to just give a shout out to Ronnie and the staff at what an incredible achievement it is to have woman after woman and family after family just saying, like, I was so happy, I was so safe, I was so respected. Like, that is just not the norm, unfortunately. And like that, just what an incredible job this hospital has done and the staff has done is just, it is beyond remarkable. So I just wanted to throw out the biggest kudos to Ronnie and staff, and then also to Ynez for capturing this just absolutely precious information. Is such an accomplishment. I'm just so impressed. And then just a couple things that has stood out to me. One was the women talking about that initial experience of bonding. They were just so excited and so happy. Like they didn't take my baby away from me. I got to keep my baby with me and it was so great. And that just that one practice made such a difference to them and their initial relationship with their baby and their whole experience with their partner as well. That yeah, they had days after that to snuggle with their baby and love on their baby, but it was that initial right after birth time was so meaningful to them. And that was really cool. And then the other just a thing that blew me away was a lot of women, it's, you know, one or the other. They either say, yep, I was expected to be treated terribly and bullied and ignored. And I came in and I was blown away by how well I was treated. So either they had really low expectations and were blown away, or the other thing that I saw was that they were like, oh no, I wanted to go to this hospital because everybody says you get treated so well here. And so like they went in with really high expectations of being valued, of being respected, which is incredible. That is such an accomplishment to have such a reputation in an entire region of like, no, I'm going here because I'm going to be treated so well. So I wanted to highlight that and how lovely that was to see as I've been processing these interviews with Ynez and Michelle. So thank you all for what you're doing. It matters and it makes a difference.
Thank you, Sarah, for your kind words. Really, it's yeah, it's really great to hear this, and I don't know how we got this reputation, but only with hard work since the beginning. There was a question in the chat that, if you allow me to answer, the how are the midwives motivated? That's the hard part, always, to motivate people. But I will say the key to this is that to believe in the model. We always have been defending the model against everything, because everyone tries to change something when it's not profitable to use a word. But we know that is the best. So all midwives here in every unit of the maternity ward is committed to this, and they believe, and there are many applications to work here because of the model. So also we know that when we receive a new worker, they want to do this. They want to express themselves in this model. So I will say that. So it's really a teamwork, and it's a day after day effort from everyone. So I'm just a face here. I'm not responsible for all, not at all. But yeah, I just want to say that the team is great, and they're doing incredible work. So thank you.
Ronny, I do have maybe like an additional question on that. Is there specific training that's done for the incoming midwives when you're onboarding new midwives into the team?
What we most focused on is in the interpretation of the baby monitoring. That's key, because that is going to lead to some indications and actions. So what we do the most is to focus on that. And also there's like a training with the more experienced midwives.
And I know you've mentioned this, but a lot of your midwives, a lot of them have not worked previously at other hospitals. Is that right?
Yeah, many of them. So
Okay.
the thing is that the hospital has about 10 years working, and we have some midwives that this has been their only job. But as I said, well, new generations of midwives come with this idea of how to give the care, how to use this model. So it's easy for us to take them and to show them this road that we have been through, and to walk with them. So it kind of flows, It's hard to explain because it's not something too structured. It's something that we know our boundaries, we know our limits, we know our way, and we flow, we go. Because it's really dynamic also. The needs for each woman are different. So we have to be flexible with that too. But yeah, there are others that have been working in other hospitals, and they hear about us. So they come with their experience, and they have to rebuild themselves. Like I did. I've been working here for almost 4 years. I come from the private sector, and I have to forget many of the things that I knew and to relearn. It was hard also for me to get into this. But when you're in, you just don't know how you move forward. You just the hard part is to blend.
So we have a lot of questions in the chat. There's one, Ynez, I don't know if there's any in particular that you would like to respond to, or if there's other points that have come up that you want to mention, but I did want to respond to the person who was asking for a link to the study. So this is preliminary data, so this has not been published yet. And actually, that's one of the reasons we have you here with us, is if there are specific things you would like to mention or comment on that would help Ynez inform the work going forward as she's completing this analysis. Your comments are very valuable for what we would, we're hoping that we will get to publish some of this work eventually, but it has not been done yet. Ynez, do you want to say anything or comment on anything so far?
Yes, sure. First of all, I wanted to comment on something that Sarah said and her observations about the interviews that she's read so far. It's a small thing, but you mentioned how grateful the patients were for having immediate time with their newborns after the birth. And I wanted to say that doing this, it doesn't come through in the transcripts, but when I was doing the interviews themselves, it was always at that point when they were discussing the time that they spent with their newborns that like the mood shifted completely, and women were just like so happy to mention that they got to spend time with their newborns. So I wanted to say that because there's certain things that you miss when everything is transcribed, but that was very sweet and one of my favorite parts of doing the study. And then I'll quickly respond to Dr. Jemima Dennis Antwi. She asked if this was a one-off study or a standing project. I received a fellowship from my undergraduate university, which is for recent graduates to do projects abroad. So unfortunately, it's kind of a one-off because it's specific to my university and not about midwifery or childbirth or anything in particular. And let's see, I'm not sure. I think a lot of these questions are probably more towards Ronny. The question about, I think I've lost it, but someone asked also about the time frame in which I did the interviews and how women's opinions can change. And that's definitely not something that this study is really able to explore, unfortunately, because I did every interview within like the 3 days post-birth. But I will say that, as was mentioned, so many people come to this hospital because they hear references about how good it is or how the care is different from other public hospitals. So at least we have a hint that people still think the care is good when they're talking to like their friends and relatives about it, but not in any kind of, just in an anecdotal way, I suppose.
I mean,
Yeah.
it would be interesting. I don't know if it would be possible to get follow-up information. Lenka, it is a good point that we know that it takes time to process experiences. So that is a limitation, that everyone was within the 3-day window. I also wanted to say, Jemima, we don't have specific funding for research, but we do support any ICI in general is always open to students who want to develop projects. But we, there is maybe the question of like, is funding available? But I will always meet with someone who, when there are students who are interested, and we try to develop something and work with them to figure out what would be a good placement for them. Sarah, yeah, you've got your hand up. Oh, you're muted.
This is very limited, but there was one woman who had 2 babies at La Florida. And so she talked about her previous experience and the current experience, and both were super positive. So I don't know if I don't know, Ynez, if you remember off the top of your head if there were any others like that, but we've definitely come across some.
Yeah, I always asked about why they chose the hospital in specific. And a lot of the times it was, well, I've been here before and I liked it, so I'm coming back. But obviously that misses people who might have had the other thought process. So yeah.
And it was interesting to me too, because there is this friendly humanistic model throughout the hospital. Someone had actually mentioned that her parents had come there for surgery, so not necessarily the maternity, but that they had been treated so well in another part of the hospital, and enough so that they felt like that was a strong enough recommendation that they felt safe going to the maternity as well, which was interesting to see, and kind of unusual. I also I wanted to mention, because I know, Ynez, you had to really like go, like there was a lot of data to process. So we didn't get to go through some of the, like you went through sort of some of the more serious complaints, but it's really notable because some of the women, when asked to identify something that was negative, I mean, it was down to like they didn't bring enough water, like glasses of water. Like someone, like that was all she had, was that she wanted a couple more glasses of water over the course of a day. I mean, like the complaints were that they could get to a point where where that was an issue, where she was like, I got 3 glasses of water. I would have really needed 4. I would, because I was breastfeeding. Someone had commented that the security guards don't know directions, can't give directions in the hospital. I mean, those are like, if those are the complaints, that's kind of amazing. It's really interesting what people said when they were asked to say something that they thought could be improved. I think it'll be really great when we can actually kind of have all of that together. I'm just going back here. Oh, Ray had a question that I think is directed towards Ronny, and maybe Ynez, you also have a sense of this, but I think I maybe know what this would be. But as you're working through the 12 steps, like which one has been the most challenging for the team in the maternity?
Is it for Ynez or for me?
I mean, either one of you.
What do you think, Ynez?
I'm thinking of my staff interviews, which I really haven't gone through at all yet, but from my memory of what was brought up the most, it was about information, the feeling that patients come and the fears they have or anxieties they have might be because they don't know what's going to happen. And so along those lines, I know that distributing the birth plans has been difficult and something that's talked about a lot. And yeah, in that sense, I'm not really sure what's part of the 12 steps that would best correspond to off the top of my head. But yeah, distributing information seems to just keep coming up.
Oh yeah, that's step 1. And of course it's hard to implement a new idea. In this case, it was the birth plan. We have been working on that for about 2 years already. And we haven't reached that many women. So we would love to cover a bigger part of that. But also I was answering Ray that the step 10, involving the rest of the hospital, the institution itself, the directors and all, because it's many of them just hear ICI and they say, what is that, right? What is it for? So it has been hard to make them believe this is real, that this is not just a logo or a paper. It's an institution, it's an organization that is helping us to know where to go. Because I always said, and we are a different hospital within Chile. We are the lead hospital in this area. So sometimes it's hard for us to find a reference inside Chile. So we open ourselves to find reference within you guys around the world. So this is our reference, right? This is our north. This is the light that we have to follow. And to make the directors believe in that, sometimes it's hard. But yeah, hard is it is what it is. It's not impossible. So we continue working with that, and we will, and we have been making great steps towards that.
I wait, sorry, there's more. And everyone, we're not that big a group. If you want to, everyone wants to put on their cameras and unmute, if you want to give a comment or a question, I think you can go ahead and do that or raise your hand and we'll call on you. Please go ahead. I am wondering also what Lenka, in response to your question about, the feeling, especially like people having a positive response if they felt like it was sort of a near miss situation. I don't think, Ynez, were any of your interviews with anyone who had gone through like a particularly like tense like issue during their birth where they had to be, where there was a real emergency situation?
Off the top of my head, I don't think so. Yeah, I didn't speak with anyone who had more than like that kind of disrespectful negative interaction. Of course, there were some people who, their expectation for their birth didn't go as planned. Like they wanted to have a vaginal birth and it ended up being a cesarean, and they were like clearly unhappy about that, but not in a way that was directed at any particular interaction in the process. From what I'm remembering right now.
Yeah,
Yeah.
I think it would be good to go through because from what I had seen, there were some that had been induced and they weren't progressing. And then they took a decision to go for a cesarean, but it wasn't like a we need to get you into the emergency room right now situation. It was we decided as a team. Sarah, did you?
Yeah, that sounds
Yeah,
right.
I don't think we had any of that, and I don't. Yeah.
Yeah, I didn't come across any yet. And I think that's also a credit to the staff because the women would say things like, you said, this didn't go according to plan, so we acted appropriately. Whereas in a lot of the kind of where I live and work, people will have a very normal birth, like a completely normal birth, and it's contextualized as just this massive emergency and tense situation. And so like the staff help them feel like, okay, well, this, and this is happening. So this, and this is the best course of action, and do that in a calm way, I think is a huge credit to the staff that the women weren't perceiving their experiences as kind of a stop, drop, and roll emergency. I think that's really cool.
Yeah, and of course that's, as an example, like we also have a hospital that's working with ICI that is handling primarily obstetric emergencies. And so like they're working in a very different scenario where like certain things are not as possible. Ronny, go ahead.
Yeah, I want to say that we do have negative comments. It's not that we don't. We don't make it perfect every time. We make mistakes. We have to analyze our when things go wrong, but what I will say is that we always take care of that too. We hear the bad things, and we try to make them better. So of course, an optional voluntary interview, mostly you'll find good comments in any time of interview, because when people don't want to talk, it's hard to find when people want to really say bad things. So we have to be honest with that too. But yeah, mostly as you said, in emergencies that we have regularly, most of the time things go right, and people are grateful for that. And when things don't, not all of them are angry at the hospital, because there are also many situations that it's just obstetrics. You cannot do anything more. So I will say once again, the time to talk to women, the time to give information is key. It doesn't matter if it is good or right, but just to say the things, it's important for the people.
I'm sorry, Julia, did you have your hand up?
Yes, I wanted to ask about the birth of plan, because not so many women were bringing them along, as I understood. And I wanted to ask if they are just handed the birth plans or if they have the opportunity to discuss them with a midwife or someone from the team in beforehand. And also how the medical team is, because I understand that it's amazing for midwives to work so closely and to offer all this care to the women. But how is the medical team? They also must play along, or otherwise wouldn't be possible. And I find more resistance with doctors in birth plans, regarding birth plans, than with midwives. I wanted to ask how this works out for you.
Well, it's true. We always find more resistance with doctors, but we have great doctors here. A young team mostly also. That is, as I said before, the model that this hospital was born with is something for everyone. Doctors, midwives, technicians, everyone. So we are all inside this. And it's true that we discuss and we fight sometimes for things and we get angry with each other. It's part of the process. But at the end, the model is bigger than us. And we believe that each one of us knows that you cannot change the model. You have to work with it. And our doctors too. So we have also good chief doctors that has put their step down when things go hard. But mostly the team believes in the objective. That's one thing. And about the birth plan, La Florida Hospital has 9 clinics, small clinics, that has the pregnancy controls. So we met with each one of these 9 clinics to explain the birth plan, to let them know the what we want to do. So what they're doing is that they are handing the birth plan around 28 weeks. So at the beginning, it's just take it home, read it, and the next control, we are going to discuss the things. So that's the idea. The midwives at the clinics are really busy with controls after controls of every woman. So sometimes they don't have much time. But the idea is that also put a responsibility on the women to read and to ask the question, to be active since the pregnancy about the birth plan. It's not that we're going to explain everything. It's a little book of 4 or 5 or 6 pages. I don't remember from my head. So it has a lot of information, a lot. And the idea is that they read it, and if they don't understand, they ask. But it's something that, as I said before, is still a working process. We have to cover more and more women. But it's a step that we took years to take, and thanks to ICI, we did it.
That sounds fantastic. If they not only get handed, but they have many opportunities to discuss their doubts and everything with the professionals. That's my dream, that we have this also in pregnancy, that they have the opportunity to discuss their options and think about every possible option in advance. So congratulations on you for that. It's really great.
Thank you so much. And also, as Ynez said, they can download it from the website or the Instagram. Instagram is really active, and there is a team of midwives that is putting up content and things. So also women can go there and download their birth plan at any week of pregnancy. So yeah, we're trying everything, and we hope it works.
Yeah, I just love that one woman was like, "Oh yeah, I got that on their Instagram." I just thought that was really cool.
Yeah, and I think that as as we finish going through the interviews, hopefully more information will come out, but I really liked, one woman commented that she had a latex allergy, and so she had reported on her birth plan. She turned it in when she checked in, and she felt really good because she said that the room had been prepared, like all the latex, there was no latex. She had her area that was prepped for her, and it really made her feel respected because she felt like, you know, she made the birth plan and then it was received well and it was followed. And she said, I didn't have to stop and remember and tell people and advocate for myself on the moment. Like I just went in and it was all ready for me. And I think also, I mean, we see the resistance as well from teams of as far as like what's going to be in the birth plan. But I think having those examples of like, no, this is practical information that everybody needs to have on the same page. You know, like allergies, things like that, because I think also sometimes people have some doubts. And that also came through that the women felt like they had realistic expectations when they had the birth plan and they were prepared to adapt if their plan couldn't be followed. And I think there are some comments around that. So I'm hoping that can be explored in the analysis.
Yeah, I definitely had that mentioned like very frequently with women who had birth plans. They said, yeah, I brought my birth plan, but they still asked me like, you know, frequently if there were certain things that I wanted, that even if they might not have wanted them on the birth plan. So it helps people feel like their care is being taken seriously, but also there's plenty of room for them to see how things go.
Oh, Ynez, thank you for putting the Instagram in the comments. I wanted to mention, I should have mentioned this at the start. We will be repeating this presentation in Spanish. I know that we have some of our Spanish speaking team members on the call, so we will be doing this again. So in Spanish for those who want to hear this presentation. Does anyone else want to go ahead and unmute and give a comment or question before we wrap up? I'm just going back through the chat to see if we missed anything. Mhm. Oh, and I just wanted to mention on the comment on the one-to-one care, I think that is, I mean, it is something that not everyone is able to provide. I think, you know, Ronny and your team, it's really fantastic that you're able to do that. That's part of the reason actually that we chose La Florida and for Ynez to go and see, because you have some opportunities to do a really fantastic level of care, and we really wanted to understand better how things are working so well so that we can understand if there are things that can be replicated. But obviously the one-to-one care is something that in some settings just is not an option. I wanted to also ask how many people are companions are allowed for the women who are in the room that with the dividers?
One, the whole time.
The person. Ray, would you like to add anything before we close?
I'm so happy to hear this and know that ICI can be implemented with not too many bumps in the road. And it's interesting that Ronny mentioned about the higher ups or the ones in charge. I hope they see those satisfaction surveys, because that seems to be what CEOs are looking for, is those satisfaction surveys. And hopefully you'll get more support, because that's important for you as well, to keep on providing respectful evidence-based care. And I so appreciate you. And thank you, Ynez, and thank you, Sarah, for all the work you do too. And of course, Michelle, thank you.
Thank you, Ray.
Does anyone else have anything that you would like to add in? I was just going back while you were talking, because in the expectations, also the fact that this is a public hospital where you're able to achieve this, I think it's really, really important to highlight that this is possible. And that was even in the expectations from the patients in the interviews, that one of the women said, I didn't think it was going to be this good. It's a public hospital. I didn't think that like this could happen. I think it's really amazing, the team, all the teamwork that goes into it and the dedication. And we're so grateful, Ronny, to you as an ICI partner, and also really as an ambassador for ICI constantly. And it's just been fantastic to work with you over these past 3 years. We're really, really grateful for the example that you're setting. And as I think we got all the comments, just people thanking you. Thank you so much for coming to us with this project proposal. I think that this was such a fantastic experience for everyone. I'm really, really grateful that you were open to going to Chile to work with La Florida Hospital. I think that this was such a good match, and that you put so much time and effort, and that you stayed in Chile for so long. And I mean, we almost didn't get you out, but I think I think there was a moment. And you're going to do fantastically at UCSF. She's heading out and leaving Chile this week, everyone. So that's part of the timing for this session as well. But this work is ongoing, so we are welcome to any comments, and we will definitely be keeping you updated as we have more progress. And Sarah, thank you so much for jumping in and pitching in with these interviews. Sarah has been with us for quite some time, volunteering her time and her fantastic experience. So we're really grateful. And Ray as well, IMBCO, for keeping these webinars going. We're back on schedule. We're going to be doing this every other week. So the next one will be, let me get I believe it's August 7th, but I'm really having trouble keeping track of time. So let me, let me make sure. We are expecting to have 2 more webinars in August on Wednesdays at this time. Yes, August 7th and August 21st. As well as we will be doing some sessions in Spanish. Ronny also worked with us on and Sarah has put together the 12 steps in Spanish that will be coming up hopefully very soon. And then also we will be presenting these results in Spanish for those teams who would rather have these sessions in Spanish. And I'm sorry, we've been like slow to get that part going as well. Thank you everyone for staying with us for almost an hour and a half. Let's see, I think we've got all the links that you need in the chat. If you want some more information about La Florida, go follow them on Instagram. You can get their updates. I'm really impressed by the social media as well.
Thank you so much to everyone who listened and had great questions and comments. It was really nice to be able to present my results. And of course, another thank you to everyone who's been helping me. Ronny, especially, he picked me up from the airport when I got to Chile. He helped me with everything, and he's driving me out on Sunday. So not only has he helped with all my research, but he's also been like had my back for everything that I've needed being here in Chile. So I really appreciate that. And that's all. Yeah, thanks again to everyone.
Thank you, Ynez. Thank you, everyone. We hope to see you in a couple weeks. And if you also have ideas or things that you would like for future topics, please do reach out to us. Also, if you do know, students who are interested in doing work with us, we are open to helping develop student projects. This one has been really, I mean, so phenomenal, Ynez. I'm really grateful.